Welcome to another episode of the Holistic Fat Loss and Fitness Podcast. Every session is about helping our clients and members live better, longer with real life scenarios. Good morning for now, Jeffrey.
Hey Sam, how are you? So I was thinking about inflammation from two aspects. One, the post-workout inflammation, but then the kind of the what you can do in terms of being proactive in your day-to-day life to reduce inflammation. Because I more and more research is pointing towards inflammation playing a role in chronic disease, but also in mental health problems like depression now as well. But I wasn't sure what perspective you were coming from with inflammation.
All right, I have a bunch of perspectives to go through today. Vince,
Hmm.
good afternoon now. Welcome. Just because I got so many questions actually, so thanks for sending both yours through actually, Jeffrey and Vince. Yeah, I think I got close to 30 or 40 questions come through. So tends to be a topic that I think people want to learn more about, which is cool. It's kind of exactly what we're doing. So I'll probably give each question the respect it deserves and sort of go into both of yours next week, Jeffrey. And same with you, Vince. There was a bunch in yours as well, just so people can understand. Like inflammation is not as cut and dry as some of the other topics. It's reasonably complicated. So hopefully in the next 4, 6, 8 weeks, however long it takes to kind of get through the level of detail and the questions that come through, we can actually sort of start to tick off what it is and kind of give people a good understanding of where my brain's at when we're talking about inflammation. I'll start with Jeffrey and then I'll go to Vince. Like where does your brain go when you think of inflammation?
I guess initially it goes to the kind of post-heavy workout inflammation, particularly the next day with the soreness. That's probably the first place it goes.
Yep.
The other place is just general inflammation through things like lifestyle and how we can reduce that or increase it, which you don't want to do, obviously.
Good insight. Vince?
So having just gone through my little journey with Anth, which I'm still kind of going through, I'm really interested in the gut inflammation aspect, to be honest.
Mhm.
I mean, I see that it works. I understand that clearly it works, but I don't really get why it works. I find it amazing.
Great. But let's start with, before we get down to the nitty-gritty, I kind of wanted to go through a bit of an overview of inflammation so that people can actually attach to what it is, there's good and bad to it, how it operates, the cascade of it. And I'll probably try to get into a little bit of fat loss today because people mentioned it quite a bit. And then throughout the course of the next few episodes, we can deep dive into the specifics of inflammation and what it does, because there are a bunch of specific questions that have come through. So chime in at any time today with any questions that pop up. I want you to think of sort of inflammation. It's like can be like a fire. And the way I would like it to be is kind of like a controlled campfire. Helps you, I guess, if you're out camping, cook your food and it'll help kind of keep you warm. But if that fire burns out of control, it's going to destroy everything in its path and could set the forest on fire. So we've got sort of acute inflammation, and we're going to label that as good, which it kind of happens when you injure yourself, you get a little bit sick, or, as Jeffrey mentioned, you train hard and you get that sort of recovery. All it is it's your immune system activating to heal and repair itself. It should be short term and productive. So, like the example is like if you're feeling sore after a tough workout, your body is then healing and getting stronger because of that. So, let's dive into sort of some of the physiology around it. So, like you kind of get like a trigger, I guess. So, like some form of tissue damage from trauma or exercise, or it could be, a pathogen. And then your immune system will activate on the back of that, which is really great. You also get things like a cytokine surge, which are just inflammatory proteins in the body that are associated with inflammation. You'll get things like vasodilation in the body. You'll get some prostaglandin release. You'll get sort of all sorts of white blood cell activation due to the immune response. And you'll also get, some tissue remodeling, which is actually really important in terms of supporting building muscle or hypertrophy, your protein synthesis, and also anything to do with your mitochondrial function. But then we get quote unquote bad or chronic inflammation. And this is where the sort of fire's gotten out of control, so to speak. Generally speaking, it's low grade, but long-term inflammation can be caused by a whole bunch of things, but standard causes: poor sleep, overly stressed, processed food, gut issues, overtraining. These are all sort of key areas that tend to lead to low grade chronic inflammation. And what does it lead to? For most people, it's kind of fatigue, low energy, poor recovery. They'll generally have some form of joint, ligament, tendon pain, stiffness, and some form of stubborn body fat that they can't get rid of. When I'm kind of assessing somebody, it's kind of like, or if it's you yourself, it's like, am I always looking puffy, in the cheeks, in the face, around the eyes? Am I tired? Am I always sore? Am I always lethargic? That's a good place to start. And you could even then throw in, despite doing all the right things, eating well, exercising, and doing a bunch of those things. It's like, well, maybe there's a little bit more going on. The way I like to think about it is acute inflammation is your body just trying to upgrade itself, really, while chronic inflammation is kind of keeping, I guess, your phone on like a low battery mode. You can function, but it's slow and it doesn't work to its full potential a lot of the time. So there's some really big systemic consequences of chronic inflammation. And that's kind of where I want people to probably attach to the most out of today, just so they can understand. Like when I'm doing it from a coaching lens and I'm trying to get on top of things, inflammation would be one of the top couple of things that I'm looking at, purely just because it affects almost everything in the body. So, like, let's look at the stress system. Chronic inflammation, it triggers chronic or overactive sympathetic nervous system activation, which is just the part of your nervous system that's go, 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 fight or flight. I think most people will know it as. What that does is it just raises your stress hormone cortisol often, and it impairs any of your HPA, so your hypothalamus pituitary adrenal feedback mechanisms. What does this normally result in? Well, just burning the body out, burning the candle at both ends, anxiety, fatigue. That's what this overactive stress system will equate to. When it comes to muscle mass, it'll inhibit your mTOR, which just has a really big function in promoting muscle in the body. So what happens is it will lead to some form of anabolic resistance over time. It'll affect your hormonal health. It suppresses your gonadotropins in the body. So it decreases testosterone, it increases estrogen dominance, it'll disrupt thyroid function in the body. So it'll actually affect the conversion of your T4 into things like T3. It'll affect fat storage. It has a really, really big role in driving visceral fat accumulation. And for those who don't know, visceral fat is the fat that's deep surrounding your organs. You need a little bit surrounding your organs for insulation. You don't need a lot. And it has a really big role in, honestly, pro-inflammatory cycles in the body and also disrupting hormonal health and putting an impact on your overall stress system in the body. So it's a pretty vicious cycle, visceral fat, extremely toxic. It affects your energy and your mitochondrial function in the body. So it literally leads to mitochondrial dysfunction, fatigue. You'll normally feel poorer while you're training. You'll be fatigued while you're training. You'll get things like brain fog and lethargy throughout the day. These are all things that look like mitochondrial dysfunction when I'm assessing somebody from a symptomology point of view. It'll have gut and digestive impacts. So it actually, if you think about, you're in your digestive system, you've got all these microvilli. What you actually want, that's where the absorption happens in the body. They should be tight. The actual cells of those should be nice and tight together where things actually can't get through. Inflammation breaks these tight junctions apart. It increases a thing called zonulin in the body, and that impairs your secretion of sort of your IgA, and it increases things like histamine reactivity in the body, which further then promotes more inflammation in the body. And it really has an impact on your immune function just by being constantly activated. It actually suppresses your immune system's ability. So you'll normally wind up with more colds and poorer healing, and on the back of that, just more fatigue. So if I think about my body as like 100%, if that's kind of my total percentage that I've got, if a lot of that function or percentage is getting taken up by inflammation, just by default, it impedes my body's ability to then do other functions in the body. Or it'll then be forced to prioritize what's essential and what's not based on the percentages left that we've got to deal with when there might be other things that are more important that it needs to prioritize at that point in time. Let's just take a quick stop there. Any thoughts and feelings around that, Vince?
So I think from what you're saying, I kind of am starting to understand. So it's kind of like if I'm a car. So just say I'm like a high performance car, and I have I don't know, some fancy GPS system in there, the aircon running full blast, and I've got a laptop that's plugged into the cigarette lighter, some subwoofers at the back, all that sort of stuff. If I've got all that stuff running, it's obviously going to draw energy essentially away from the motor and affect overall performance of the vehicle because I'm doing all this other crap as well. So essentially, is that essentially what's happening? So if the gut is right, you know, running at a better level, that allows the rest of the body to I guess have cleaner fuel, but also not have to have all the other systems supporting what's going wrong with the gut. Is that essentially kind of
It's a
the
pretty
idea?
it's a pretty good analogy.
Okay.
Like pretty succinct. Yeah, everything's just so interrelated. Stress,
Mm,
inflammation, gut. And when, especially with like stress, inflammation, gut, nervous system, they just pull on each other so hard, depending on one of them being out or overactive. And it's not just like focus on one and you're good. They're like an interwoven web, is kind of how I like to look at things. And by pulling on one, it just affects everything in that web. And by default, if one of those is in dysfunction, I would dare say you'd have a couple of them in dysfunction, is kind of how it really operates. You don't normally have like three out of those four running optimally and then one that's kind of subpar. It's normally they're all out by a little bit and one might be impaired more so depending on the cause of it. But yeah, absolutely. And then just put strain on everything, like
mm.
serious strain on the body more so. And then through that, we just find that we end up having things go wrong or compensation that occurs that affects somebody's health or just whatever their outcome is that they want in the gym.
Yeah, nice.
Jeffrey, anything to add to that?
You mentioned something about muscle and mTOR. What's mTOR?
Perfect. It is a part of the body. So it's actually a key pathway that is actually used. It's called mechanistic target of rapamycin. I think it used to be called the mammalian target, but it's kind of been found that it's in everything, not just mammals. What it is, it's kind of a growth master switch, I guess you'd call it, growth and repair switch, actually inside your cells. And when I'm looking at I guess a hypertrophy program or a body composition program, anything that's looking to grow, what I'm personally thinking about is how does this program either stimulate or suppress mTOR? And if I can get it to stimulate more often, not suppress, then I know that that person is going to have a much better, efficient way of building muscle. So when it's activated, your body knows that it's time to like build, grow, repair, is probably the easiest way to put it, especially when it comes to muscles. So things like high stress, overactive nervous system, inflammation, down regulate mTOR is probably the best way to put it. I'm not a firm believer in the body that, we talk in switches a lot, like off switch, on switch. Almost all processes in the body are running at all times. It's just in different environments, there will just be different activation and suppression of what the body's able to do or what it prioritizes in that function. Does that make sense?
Yeah, so if you're kind of chronically stressed and you've got chronic inflammation, but you're working out at the same time, that can then inhibit muscle repair and growth because you're chronic. So if you want optimal results, you probably need to look at managing things like stress and chronic inflammation as well.
Yeah, 100%. And
Yeah.
that's why we see it a lot with we get people to get better results and they train less frequently and do more recovery and do more of the holistic practices, right? Let's talk sleep. Let's just talk good quality food and gut health. And it all sounds a little bit non-specific, but what we're actually doing is trying to get the body's pathways and the ones that matter, things like an mTOR, to actually be increased and optimized efficiently comparatively to if you're stressed, let's just take parents, people that work a lot, people that, live in the inner city, they've got long hours, stressful jobs. Then on top of that, we add in exercise, which is supposed to be a good thing, but it can be too much for somebody's proverbial stress cup and add more inflammation to the body rather than being done appropriately, mixed in with very little recovery, inefficiently trying to train the body, really. So you might get the catalyst in the gym of the training, but if your body doesn't get enough recovery to have the right mechanisms in place, you might get a little bit of growth, but it'll come at the cost of recovery, inflammation, nervous system, gut health. There'll be a bunch of things that your body needs to dip into, like Vince was talking about, to try and get any growth possible. Normally, we'll see you kind of get one step forward, two step backs a lot. So people can either stay in the same place, feel like they're getting nowhere and spinning their wheels, or progress is really slow compared to the effort they're putting in, purely because they're just fighting against where your body's at in terms of the pathways it's activating and suppressing, depending on what our day-to-day habits are.
Yeah, makes sense.
On that, let's touch on that because it's good, because I want to talk about how it affects the whole body and kind of why that matters for fat loss specifically then. So like overly stressed, overly inflamed, overactive nervous system, they kind of go hand in hand as a nice little team. Specifically, let's talk about fat loss. What it's actually going to do with chronic inflammation is like it's going to actually just block fat burning. Suppress is probably the better word. You got to think when your body's overly stressed, it is in survival mode. That's the key sort of where your mindset of your body's at. It's in protection mode. Like if it's inflamed, it feels like there's fires everywhere. Like it feels like the stress is high because it is. The last thing it then wants to do is prioritize fat burning. Like fat burning and muscle building is such a luxury for the body. In the gym world, it's kind of all most people think about, but your body will prioritize those luxuries when it's got all of its foundational things in order, or it feels like they're under control, so to speak. And then it'll just have either in that percentage that we were talking about, if it's spending less time fighting fires in the body, less time on edge, less time with high stress all the time, it just has more percentage to put into tasks that we want to do. And if those tasks are building muscle through training in the gym, then it'll be able to actually respond to the catalyst of our training and go into hypertrophy mode through, mTOR pathways. Or it'll be able to continue to stay fat burning and anabolic through those pathways, not holding on to the fat if it feels safe and protected and it has enough percentage of battery to do so and be able to prioritize. So that's why so many people who are quote unquote doing the right things feels like their body's just not listening or the old things just aren't working. It's just that the body just has too much going on internally in terms of a stress inflammation response where it just can't actually prioritize the things that it wants to do. And you can get away with it when you're younger because your body's resiliency for that kind of stuff is just a little bit better. But also, it's just not as stressed out. It just doesn't have the accumulative wear and tear on the body, which is just low grade inflammation anyway. Like you're just going to get more of it as you get older just because life is being lived. Tissues get broken down, joints have been used, brain function has been used for 20 or 30 more years longer. There's probably more responsibility in life and in your job. So we need to get on top of inflammation so that we can actually optimize the body efficiently. When it comes to stress, we're looking at obviously it keeps your nervous system in survival mode, which I just talked about. And when you've got a sympathetic dominant nervous system, all you've got is high cortisol often, which means your HPA axis is just firing. And when you've got high cortisol, your body will not prioritize things like fat burning. It'll prioritize fat storage, especially because you have more fat receptors in and around your stomach. Even though cortisol stimulates some fat to be burnt, it'll prioritize storage of fat over time comparatively, and it breaks down muscle, which isn't ideal. So speaking of muscle mass, high inflammation will reduce your ability to hold it because of this mTOR, and it'll create anabolic resistance. Let's talk hormonal health, which most people don't really think about when it comes to fat loss, but it's actually one of the most vital ingredients to your fat loss journey. If we're talking about just getting the foundations of the body in order, it disrupts all your sex hormones. So it'll lower your testosterone and it'll increase your estrogen dominance, I should say, which isn't ideal. Testosterone is one of the biggest builders for muscle and keeping you anabolic. And it's actually not just about testosterone, it's about the ratio between testosterone and estrogen that is actually really important as well. We've touched on it, but visceral fat, high inflammation is going to encourage visceral fat around your organs, which is just a high inflammatory sort of and metabolically dangerous organ of the body, if we want to call it that. It impairs your energy levels. So impaired mitochondria means that your body's going to make less energy, even from the food and the exercise that you do. So from the food that you eat, you get less energy, you get less metabolic energy at rest, and you're going to burn less energy at exercise. Energy expenditure is just a real thing when it comes to fat loss, unfortunately. Vince, you touched on it. Gut health, it affects your gut health. Think of damaged gut lining. Damaged gut lining causes inflammation all over the body. It's got a direct pathway to the brain to allow the brain to understand, or your nervous system to understand exactly what's going on the coal face. You've got to think your gut is actually exposed to external pathogens just via the nature of the absorption of where it is. So the body has a really big direct link to that area of the body so that it knows what's going on. So having that inflamed gut, well, that leads to potential more food sensitivities, more bloating, more irritable bowel, more fatigue, more inflammation. And then overall health, yeah, we've talked about it. It's linked to diabetes, it's linked to depression, autoimmune things, heart disease, neurodegeneration. So lots of things that inflammation is attached to that isn't just fat loss, but I give it to people through a fat loss lens because most people listening to this podcast and in the studio are interested in how to improve their physical well-being. I think the biggest thing that I tell people is fat loss isn't just about calories. They're important, don't get me wrong, but it's also important about how safe does the body feel? Is it in stress and protection mode, or does it feel like it can prioritize the tasks that we actually want it to do? So here's kind of what I would do to actually get out of that, I guess, that survival mode. There's probably five of them, so we'll call them the fast inflammation five. That has a nice ring to it. Kind of goes like this: be in bed by 10 p.m. with no screens. You'll hear a whole bunch of recovery people out there. Nothing recovers you better than sleep. So you'll hear me talk about this a lot on this podcast and just a lot with every person that I coach. Whatever we do, whether it's run to get fit or to burn calories or strength train to get the strength improvements in our nervous system, or whether it's resistance train to tear down the muscle, all of those things are just the catalyst in the body. They initiate the process, but the actual building of it and the repairing of it happens when you're not doing that task. And the vast majority of it will happen in your sleep. So if you're not sleeping well and it's not good quality, and we'll go into sleep at another time as to the different versions of what differentiates quality to not quality, you're just leaving results on the table. So, and people overemphasize the hard portion of training as being the version of what they need to do to get the result comparatively to the recovery process. There's truth in that you need the catalyst. So you're not going to get fit without actually driving fitness. You're not going to get stronger without actually pushing your nervous system with more resistance or more weights. But if you're not recovering, you're still not getting the best bang for buck out of whatever the task is that you're doing. So again, a lot of people feel like they're spinning their wheels because it's harder at the start, but easy to get your gym routine in order. It's really difficult to get everything else in order. But I would say if you actually prioritize everything else over your gym, you would find that you get far quicker results. So I would also walk to 20, 30 minutes a day. One of the best things for inflammation, amazing for your blood sugar, amazing for hormonal regulation. Any sort of steady state, zone one, zone two will be impeccable, but for about 20 to 30 minutes daily would be amazing. After a meal, even better. I want people to eat at least, but let's go with a minimum because I do a lot of nutritional consultations and food records, and people do not eat nearly enough vegetables. 3 cups of colorful vegetables. Like I'm talking high polyphenol rich food, anything that's colorful. We want berries. We want, it's not a vegetable, but we want green tea. We want things that have turmeric. We want things that have fiber in them. Like they have antioxidants in them. They have polyphenols in them. They have things that are just anti-inflammatory and then that build your health. And if you think about it from a vitamins and minerals standpoint, you've got your macronutrients, which are really important, overemphasized in like my opinion, because when we're talking foundations in the body, so many of the processes that we need are actually a function of our vitamins and our minerals. They play key roles in you being able to do whatever it is that you want to do. And when you're under eating your vegetables, fruit, anything that is in that realm, you're giving your body less nutrition to be able to do the tasks that we need to be able to fight the inflammation. and it has a real big role in helping the macronutrients, proteins, fats, carbs, and fiber sort of to be able to do their tasks as well. So again, people are pretty good at just even most people can get on top of their protein earlier than a lot of things. But if you prioritize protein at the expense of your vegetables, again, it's like training really hard without getting in the necessary sleep. So you need protein, of course, and yes, you need to train hard, both overstated in the gym world. You also need to back that up with good quality recovery to make the most out of your training and a good amount of fruit and vegetables to be able to get on top of and actually utilize your protein efficiently and give your body the building blocks to reduce stress and inflammation to make sure the pathways that we're looking at are actually getting either suppressed or activated in the way that we want them to get the result that we're after. Then there's probably two more. One is I would incorporate obviously some form of recovery practice outside of sleep. One per day would be optimal for me. Breath work, sauna, walking without headphones, nature, stretching, yoga. I don't mind what it is, truly. Journaling, reading. There's a million of them out there. I would attach to the one that you attach to yourself that you can implement. I would start small and then I would build up if necessary because frequency is more important than, a one-off effort once a week. The last thing I would add is I would try to reduce inflammatory type foods. Honestly, if you want to reduce inflammation, food's a real culprit. So anything to do with added sugars, there's some really nasty vegetable oils out there, and there's some processed snacks that I'm just not a fan of. And I would say the vast majority of people are having one, two, or three of those every single day, which again, we are what we absorb in the body. And if we're absorbing those things every single meal, we're just allowing the body to get the inflammation from those meals or trigger the inflammation in the body three, four, five, 6 times a day, which if you multiply that over a week or over a month is a lot of times for the body to feel triggered. Vince, biggest takeaway from today or anything you'd like to add to the conversation?
It does explain a lot that I've been thinking about lately, Sam, to be honest. I do like the points. It would be good to do the one, stress reduction thing a day. It's always great in theory, and I do try to do it as much as possible, but I reckon I'd be close to 3 or 4 a week, which I still think's better than nothing, but yeah, daily would be, as you say, the gold standard.
One of the ways I honestly started implementing stress reduction was I do it in the car on the way back from work. And it would be like 2 or 3 minutes of breath work, sometimes 60 seconds. And it would just allow one, all I'm trying to do is get that cortisol to drop, right? That's kind of the key metric that I'm trying to do. Yes, you'll get mindfulness and yes, it'll get you out of your head and into your body. It'll give you a bunch of things, but I'm just trying to drop cortisol, give my nervous system a break, which is all I'm trying to do. And throughout that, I'm definitely reducing inflammation due to my nervous system going into a more restful digestive state. And the best way to do it that I found is through habit stacking. For me, it was just in the car when I got home. I had a minute or three to, yes, I look like a goose doing breath work with my eyes closed in my car out in the middle of my street, but I just found the net benefit being so integral for me. So yeah, habit stack, whatever that is. It could be vitamins with your brushing of your teeth or next to the kettle in the morning or some form of stacking works a treat for just getting people to remember and start really small if you need to. Sweet.
It's a good idea.
Jeffrey,
That list of five you came up with, that's great. I just yesterday listened to a podcast by a doctor and a scientist who researches novel treatments for cancer. And two big ones that he really focused on in terms of inflammation and its link to cancer were the colorful vegetables. He said, in particular, your leafy greens and anything from the reds and the purples, full of compounds that have actually been shown to reduce risk of cancer. And he also said, yeah, avoid any of your sugars and your salts and your processed food. He said, treat them like they're poison. Just don't touch them as much as possible.
yeah, if we were going to get super deep into it, like I think what they say is it's close to like you need 30 different combinations of food a day or something close to that. Like it's something pretty high. And if, theoretically, like all of those should be whole food, non-processed. Vegetables they get a bad rap. There's a pretty strong carnivore community out there. But yeah, they play just an integral role. Fiber is so incredible, soluble and insoluble, all the vitamins and minerals, the antioxidants that are in them, the polyphenols, it's actually mind-blowing. And like to be honest, it's almost the more the better for people. I just understand that it's hard for people to get them in, especially early, because it requires preparation. But I think we're undernourishing ourselves at the body at the moment, like most people in general, especially when I see what people eat, not from just a macro level, but a micronutrient level as well. And then I think we're in a pretty pro-stress inflammatory state most of the time, which just puts strain on the body. Like the way I like to think about stress and inflammation as a little tag team, and I say this a lot to people, is you wouldn't do this to your car, but this is what I think it actually is. You just get a brick, pull up the handbrake, and just put the brick on your accelerator and then walk away from your car for the night. And no one would ever do that to their car. I'm yet to imagine what it would actually look like the next morning, probably, smoking and whatnot. But that's what high stress is doing to our body. And we wonder why we've got so many, this is outside of my scope, but metabolic and chronic diseases in the body. Well, most bodies that I know are probably doing tenfold the amount of effort that they probably should be, just based on the environment that we kind of live in and work in and just predispose ourselves to, in a combination of undernutrient and good nutritious diets with a lack of sleep and recovery. It's like, I'm not surprised that there's a, epidemic of chronic disease in the community. The body does a pretty outstanding job at adaptation, but it can only handle so much compensation. And I just think we're asking it to compensate for so much at the moment. But it sounds tough, but those fast five would truly help. Good nutritious diet, get in some movement, get a combination of steady state, zone two, and some resistance training in, 2 to 4 times a week for 30 minutes. Prioritize your sleep and like try to get in something that like helps you de-stress. And for most people, that'll sort of tick a lot of the boxes for a lot of their goals, and it'll give them an outstanding. Honestly, it'll change the entire quality of their life, which isn't the topic of today, but just saying that I wanted to tag on to what you've just said.
When I get to work this afternoon, I'll let my boss know I can't work till 10 o'clock. I have to finish at 9:30 because Sam said I got to be in bed at 10.
Look, I'll send you a text. I'll write you a note. You'll be fine. Thank you for today, gentlemen. We'll be getting into the specifics of this topic. I'm hoping today gave you a bit of an insight. This is kind of where my brain's at when I'm chatting with people. And now that we've got sort of the overarching theme of inflammation, now we can use that theme and sort of insert it into the specifics that have come up, whether it's how it impacts recovery, how it impacts the gut, how it impacts appetite and metabolism, and things like cravings for food choices or muscle mass or fat loss. And there's a lot of different things that I want to get into, but doesn't make sense unless people kind of understand how inflammation works from a more broad brush approach. Now we can get into the nitty gritty. And yeah, I think if most people assessed, I'm obviously biased, but if most people assess people from a inflammation and how it relates to stress and nervous system and hormonal health and gut health, you would get a lot better results with people, because it truly encompasses all the different health metrics that I know are interwoven and kind of hold people back with their results and their health. Thank you for today. I hope you both took something away.
That's great. Thanks,
Sam.
That's it for today. If you'd love some support, check out my Instagram at @the Sammy Roberts. Until next time, keep living better.